patient who has chondromalacia, this is where it's all gray, you know. If it's a young patient who has degenerative meniscal tears, some chondromalacia, but they're not bone on bone yet, and they've tried everything else, a knee arthroscopy is definitely indicated. I would want one. Definitely indicated for that patient. So if it's primarily just a meniscal tear and you don't have much arthritis, absolutely get the knee scope. Yeah.
PRP, are there any trials being done here yet?
Yes, there are trials going on in the States for this now, to use it in the knee.
How do you find out about the trials?
I'm going to be a part of one. So,
you are?
Yeah.
Okay.
So I just I have 3 centrifuges coming in the next week.
He was a patient or he was the doctor?
I don't need it yet. The other thing we did, we're injecting this into rotator cuffs to try to get them to heal. We're injecting it into tennis elbow, infrapatellar tendonitis, Achilles tendons, and there's it gets more complicated than this. I used this like 5 years ago. Biomed had this thing 5 years ago. So, oh, this is the greatest thing ever, and they put this reagent in there to try to get the maximum number of platelets. But when they do that, they also elute out the white blood cells. So we're finding now that it's the ratio of platelets to white blood cells that makes the difference. And if the white blood cells are too high, it doesn't work as well. So now they're trying to get less platelets, but the ratio of platelets to white blood cells is better. So you get higher ratio of platelets to white blood cells, and it's working better. And the only one that has that now is Arthrex. Has come out with that. So, and I am a consultant for Arthrex, so hopefully I'm going to get it as that. So that's what the thinking is, and that's what the data in Europe showed. That all the studies were done in Germany. Yeah.
Yes. In regard to psoriatic arthritis, Remicade infusions. Is that helpful?
I'm not the wrong person to ask for that.
Okay.
Hopefully, but that's a rheumatology question.
Okay.
Yeah.
I have a tear in my meniscus, and while on vacation, I talked to a lady in a restaurant that claimed that she had part of the meniscus replaced with something. Have you heard of that?
She's probably confused.
Oh, okay.
Because, how old was she?
She was in her 50s.
Yeah, she's confused.
Okay.
Or she had the misfortune of having an over-aggressive doctor that's a consultant or has some sort of other secondary gain for doing meniscal transplant. Meniscal transplants are extremely rare. So that's for somebody.
She claimed it wasn't a transplant. She claimed it was some kind of substance that they put in there, not an actual transplant. It was a plastic or something that.
So she had a partial knee replacement.
Yes.
Yeah, that's what she had.
Ah, okay.
She had a unicompartmental knee replacement.
Okay.
I forget what the procedure's called, but she might have been talking about. I read it. It's very out there, but they inject something at the site that supposedly stimulates a reaction in your body to. It acts as an irritant.
It draws blood to the area.
It increases the circulation to the area and supposedly
Helps.
causes the body itself to create new cells at the site. But I forget what it was called, and it was very, very out there. Have you heard about what I'm not medical, so I'm describing it terribly.
No, we do some stuff. If it's really focal, so if you have like a pothole, instead of needing your whole new road replaced, we try to get creative with that. That's fun, you know, because we can drill holes in the bone, stimulate inflammation and bleeding, and have that scar down and form fibrocartilage. Right. That's called a microfracture. Yeah, we can take a plug out of it, like with a tulip bulb planer, and put another plug of cartilage in there and bone from a part of your knee that's not weight bearing or from a cadaver. That's called an Oates procedure. Or you can make a little mold of that area and inject juvenile chondrocytes in the area and cover it with a fibrin glue and have it regrow hyaline cartilage. That's called de novo. That's it.
That's it. The last one. De novo is sticking in my mind.
Yeah, there's only so many 2-year-olds that have passed away. And there's only so many people that need that, and it's expensive. Okay. So it's neat that it might actually regrow, but that's not going to be a long-term solution, and that's not a solution for most people. Okay. The indications for that are so tight, you know, that I may, you know, 1,000 surgeries a year, I may see one of those. Yeah.
My doctor gave me Voltaren gel, and when I read all of the side effects, I was afraid to use it.
Yeah.
I didn't realize that it went into your system and you put all those,
It's extremely rare. I just have to understand that lawyers run the world. They really do. You
so
know,
what do you say? You're saying it would be
it's not likely going to be dangerous at all. You know.
Oh, really?
Right. I mean, if you cover yourself with it, maybe. But just using it sporadically on an area that hurts is probably going to be fine.
So you're saying that all the other stuff?
That's all because lawyers run the world. They really do, you know. Of course, you want to take the minimum amount of medication possible to function. You want to be as natural as possible. But just remember, in all these nutraceuticals, be careful, right? Because all these drugs were nutraceuticals at one point, you know, and they can be just as dangerous, they're just not as studied. You know,
Well, how about the, I forget what it's called, the medication that's made from the rooster's?
that's Synvis.
What is that called?
Synvis.
Synvis. I understand that doesn't go into your system.
No, that typically doesn't.
So
No, that's
that
a
would
direct
be a
injection in the knee.
That would be a
And
safer
you know, the
thing.
glucosamine chondroitin sulfate was going to come out in an injectable form too, and that got squashed by the FDA. That may have been something.
So you think that the rooster comb?
The rooster comb is good, you know. If you have mild to moderate arthritis, it's good.
As always, what about things to prevent coming to see you?
No, I mean, if we knew, you know, if we knew.
I mean, are there things?
Stay thin and stay active, and make sure you do you do weight training as well.
Yes.
And don't do things like ultra marathons. Don't beat yourself up. Don't run forever. You know, weight loss is 99% diet, despite the TV big influence.
I don't know how I tore my meniscus, but I'm in the gym on Mondays and Thursdays. I have strengthened the muscles where I have no pain literally from it.
Yeah.
I mean, it's,
Yeah, you don't have to get it. You don't have to
worked
get surgery
around
if you have a meniscal tear.
yeah.
That doesn't necessarily. That's not like a ticket to surgery.
Right.
You know, surgery helps. If you have any acute symptoms, it's better to get the operation because you recover much faster.
Yeah.
But if you're not having any clicking, catching, or irritation, just live with it.
Yeah.
I have it.
You know what, we have to stop here.
Switch.
Those with questions, Dr.